Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional, a wellness enthusiast, or just someone curious about a more natural approach to your health, you are in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
All right, awesome. Today we are interviewing my friend Sally, who I work with at Bristle. And Sally is a holistic dental hygienist with nearly 5 decades of clinical experience who helps hygienists stay in the profession without sacrificing their bodies or their home lives. She understands how the constant vigilance of clinical practice, staying alert, precise, responsive all day can be quietly overloading the nervous system. For many hygienists, that strain shows up as tight jaws, shoulders, persistent fatigue, or walking through the door at night with nothing left to give. Short-tempered, numb, and collapsed on the couch. Sally's work reframes these experiences not as a weakness or burnout, but as the body signaling us that we've been bracing for too long. Rather than offering more ways to push through, she guides hygienists to work with their nervous system so steadiness, strength, and clarity can return. At work and at home, she supports the capable professionals who hold together all day and yet feel the cost after hours, offering a grounded path to ease, presence, and self-trust. Welcome, Sally.
That doesn't sound familiar. What's burnout? What's exhaustion and fatigue from dentistry?
Yes. And even Amanda, you and I talked a little bit about this at the end with just everything that we're doing between clinical and work and then the podcast. And not that we don't love what we're doing, but there is that time where we're just done with the end of the day and it's, I can't do another day at the computer.
Yeah. If I see one more email come across my perfectly clean inbox, I'm going to lose it.
So
What's
Sally,
a perfectly clean inbox?
I don't know. I haven't had one in a year now, so I don't know.
I actually took the time this week at Bristol because I had a little bit of downtime to clear out. I went from like 5,000 emails to like 1,000, which is still a lot. It sounds like a lot, but those 1,000 I need in there. They're past conversations that I need to keep in. But I was so proud of myself. It took me
That's a
an
lot.
hour. Yeah.
Yeah, that's a lot.
Okay.
Congratulations. Pat yourself on the back.
Yes. So, Sally, 5 decades. That's incredible and not something that you hear frequently, especially on the hygiene side of things.
Yeah.
I would love to hear a little bit more of your story, what drew you into hygiene, and then obviously what's kept you here for so long.
Yeah. Oh, thanks, Amanda. It's a pleasure. And thank you, Heather, for that wonderful introduction. To be honest with you, if I'd still be working, if in Virginia we could practice on our own and I could practice with just using the diagnostics and being the oral health coach in the practice, because that makes the biggest difference, if, in my opinion. And I think science backs that up. And you asked, yes, I graduated before so many people were born. I graduated from hygiene back in 1978. And I was like, wow, I am going to be able to take on the world. But I had started my college profession I was going to be a social worker. I cared about people, I cared about families. And then some of my upperclassmen, I was watching them go out and do their casework, and they were getting dogs sicked on them and guns pulled on them. And I thought, there's got to be a better way. And so somebody mentioned dental hygiene. And so I applied, and here I am. And when I graduated about 3 years after, I don't remember exactly when, maybe it's probably about 5 years after, HIV, AIDS came in. So that was the smoking gun that was in the hygiene. So you really have to be aware all the time of what's going on around us, right? You can't run away from any of the challenges that we all face. And we face them at home, we face them at work, with our relationships, and with our bodies, for goodness sakes.
Mhm.
Yeah, oh, I'm sorry, Amanda. What made me,
What has kept you in it? So
oh,
you clearly have a passion for helping people. So what
yeah.
kept you in it for almost 5 decades?
Thank you. Thank you. Yes, I have noticed, and it breaks my heart, and you probably have too, on Facebook all the time, or new hygienists are saying, oh, it's 2 years. I don't think I can do this anymore. 5 years, I'm out. I just can't. I love it, but I cannot do this anymore. And at 5 years into the practice of practicing hygiene, I hit a wall. I was so locked up in my back, but I wasn't aware of it. But I was losing tactile sensitivity, which is not a really good thing. And I didn't want to go an allopathic route. So I chose to see a chiropractor first. Remember how long ago that was? That was really outside the box. And for my conservative family, that was, oh my gosh, Sally's off the deep end now. But it really made a difference. And that started me looking into alternative therapies and ways that could support me and my body and to be able to practice. And so I started learning a lot of those modalities. And now I've combined them all and I teach people and hygienists how to be able to do things I learned that took me 25 years to learn. I can do that in a year. I believe that we all should be able to stay in a profession that we want to stay in as long as we want to. If you want to leave, you should be able to leave feeling comfortable and solid in that decision. And so many of us are rely on our income that it's very hard to make that decision from a really comfortable, confident place.
100%. You said so many correct things. It's sad because there are so many young, fresh hygienists that are already talking about, oh, my neck, my back.
Yeah.
I pinched my sciatic within the first 6 months.
Ooh.
Yeah, that was debilitating and it terrified me. Same thing. Like I was out on my own. It was like, how am I supposed to pay my mortgage if I can't work? It was terrifying. I didn't at the time. I graduated in 2008, so a little bit after you. They're still not strongly talking about ergonomics. Loops were not part of the conversation that was to be had. Taking care of your body, allopathic medicine, natural medicine. There was one lecture on maybe some herbs, but nothing about how to take care of your body, your physical body, your mental health, any of those things. Definitely not nervous system regulation, like I think we're going to get into a little bit today. Thank you for what you do.
Thank you. I love it. And if I can help one person, I feel I've really elevated our profession. And so you mentioned something about the pain that you got so soon and that we're debilitated by this pain. And that's what it takes. Our bodies shouldn't have to create pain before we listen to them. And so listening starts by paying attention when you need a snack. You need to sustain your energy when you need to take a potty break. Just you must take care of our body. We work in a blue collar profession. When you read the definition, we work with our hands. And so we need to look for alternative ways or ways outside of ourselves to support ourselves. And that would be stretching on a regular basis. Weight training doesn't have to be heavy stuff, but strength training, I guess I should say, just so that our bodies, which are our instrument, we use, and the instruments that we grab are just an extension of our body, the instrument. So listening is the first step to learning how to protect yourself. And what I have found is there are three ways that pain works its way into our bodies. One is that physical way, and you can tell that by when you're gripping an instrument. Do you notice any discomfort in your body? You might notice it coming up your arm or in your finger or your thumb or your other shoulder, right? So just notice how that feels physically. Then another way that pain comes in is the mental. So you're working along and everything's good. You've got enough time, school, you've done everything that you were supposed to do. You're just about to wind up, and you look at the patient says, "Oh, I forgot to tell you that upper right tooth. It has been giving me twinges." And so now, instead of that 10 minutes that you thought your doctor would be able to come in and do an exam, you're racing maybe to take an x-ray to do a little more investigation before the doctor comes in. And notice the tension that gets in your body when you think about that. And
Running behind.
that's
Now
our,
I'm going to be behind.
right. There goes that smiling patient you were going to bring back is not going to be smiling anymore, right? So that's that mental stress. And then you've got the emotional angst. And that could be a patient who doesn't like you. They tell you that the minute they sit in your chair. Or you're hearing the person behind you, maybe somebody in the hallway, maybe a coworker, saying your name. And of course, our ears perk up every time we hear our name. So that is the emotional. Notice the pain that happens then, the tension. So that's our emotional level of pain. And so we have to address those three areas to protect ourselves. And most of the time we get stuck in one or the other. Mostly it's the physical one. But if I can go a little further on this, in my opinion, and a lot of people, and this makes a lot of sense if you'll bear with me here, when nothing is solid until it's a thought first. So you have to think about making a chair or crocheting, or making a pattern before it can actually happen. So a lot of the stuff that happens in our bodies first started outside our bodies, in our mind, as it were. And then it just becomes more and more solid the more and more we think about that. Now, that becomes true when you think about in biochemistry, you're looking under the microscope. And I remember hearing my professor say that when you look at a cell, it changes the cell. You guys remember that one too? But just the act of observation of a cell will change its reaction. That also is true in quantum mechanics and entrainment, which says if something has been connected in any capacity, if there's been some sort of interaction, a molecule over in New York can affect a molecule in Tokyo at the exact same time as one of those is stimulated. Crazy, right? Now, if I may go into a story, we've all had these patients. Mine was Miss G. She's the lady who, when you see them on the schedule, it just ruins your whole day. Okay, who's yours? Just put them in your head. You can see them now. Notice what's happening in your body. So she struck fear in everybody, right? She was like, "You can't staple my papers." Or she had the list of 10 things that you had to do properly for her so that she would cooperate in the chair. Don't lay her back, give her one tissue, not two, but I had to have one. And so I noticed she was on the chair, on my schedule. So the time comes for her to come in, and I am going out to get her. And of course, in my head, I'm going, "Oh, woo, this is going to be a doozy." And then it hit me. I had just learned something that said, be curious. What if it was different? And so that's what I started saying as I'm walking out to reception to get her. So I wanted to be curious. I wanted to be open to the possibility that it could be different. So there I am, open to the possibility, curious how this can be different today. And I walk out there. She's still herself. She's not a miraculously, oh, there you are. So I bring her on back, and the whole time I'm walking, I'm going, how can this be different? How can this be easy? And then, of course, you're hearing the little gremlins in your head. You have to acknowledge them. They're going, yeah, she's such a witch. She'll never be nice. And so they're okay. I have to acknowledge those and go, you're right. She has never been nice before, and maybe she never will be again. But right now, I'm open to that possibility that today it's going to be easy today. It's going to be easy, perfect. And so then as I'm bringing her back, I hear something that said to me, I listened and I heard, she's only human. She wants what every other human wants. Maslow's hierarchy of needs. We need to feel safe. And so I took her back, sat her in the chair. The whole time I am worried because a part of me is worried, part of me is happy because I'm going, how can this be easy? How can this be easy? Working along, gave her one tissue. And then she put her hand up and I went, okay, here it comes. How can this be easy? Oh boy, I'm ready. I'm just really curious. She said to me, your arm must get tired. And I was flabbergasted. Thank God I had a mask on. And I was sitting on a solid chair, a saddle chair, because I wasn't going to fall off. And she said, I said, yeah, it does. I said, and she's a professional violinist, and which may explain her tension. And so she said, I said, but your arm must get tired too. And she said, yeah, but your arm is static. So not only did she give me a compliment, I gave one back to her and she doubled down on me. So in a good way. So that changed everything. So what I did was I was curious about how it could be different. I acknowledged those voices that would go, no, it's not going to be not going to happen, but yeah, I'm open, I'm curious. Then I listened to any kind of insight that I might get. Maybe nothing. That doesn't matter. Just keep doing that. And that's the last one is persist. Just keep being curious. And by the end of our time working together, we had a joking relationship. It wasn't like we were like best buds, but it was so much easier. So much easier.
She got comfortable, which was
She, right. And all because I changed me. Just like that molecule in New York stimulates the molecule in Tokyo. Right? And so that's the power of our mind for creating what happens around us. And that
manifesting. We
Yeah.
have to
absolute,
manifest
it is. It
positive
is.
affirmation.
Yes, and it's very simple and it really works. It's just changing your perception of how you're looking at it. We're trained to look for problems. How about if we look for solutions? And it just shifts how things are. And so that also there's science that says if you go out and you say look for red cars, and ask for the blue car, you didn't see any blue cars, but every car is red. Or you're focusing on the football play and the monkey runs across, a gorilla runs in the middle of the field. Have you guys heard these things? Nobody sees the gorilla because they're looking at the football, right?
Yeah.
So it's what we focus on is what shows up. Everything else is, it's not even there. So focus on your schedule. How you got 15 minutes for lunch today. Your drive to work was easy. Just the things that improve. And it doesn't mean that you're closing your mind to the things that need to change. Don't focus on those until you can talk with your boss and get it and change it. But harping on things, it really doesn't benefit anything.
100%. 100%. I think having those relationships with patients, and I think there's something about when you get to a point in your practice where you're like, I very well may not have any impact on this patient, but not letting that impact you.
Yeah,
That is where it's, yeah, water off my back. I care. And if they show the interest of, okay, I want to go past the static place that they've been for the past 3 or 4 years with you,
yeah,
heck yeah. But I think there's a point of fatigue of you can only cast your pearls before swine so many times before, okay, you're draining yourself for
yeah,
somebody that does not care. Not saying we shouldn't provide some education, but I think there needs to be some wisdom used in
yeah,
how you approach each patient. So no two people are coming at you from the same place. They're coming different times of day, different backgrounds, different
right.
stressors in their life. I had a patient recently in our community. He, I can't say too much. Sorry. He had a traumatic thing happen to him,
Mhm.
and we didn't do a whole lot during that appointment because I was listening to this story, but it was a big deal. And he just brought so much emotion in. We got little dentistry done that day, and
Yeah,
it was fine. It was fine because I knew him, I knew his story, I knew his family, but meeting those patients where they're at,
yeah.
but still having the appropriate, I don't know, emotional relationship. Like it wasn't draining sitting there and listening to him because it was like I cared so much in the moment. It didn't feel draining or exhausting. I hope that made sense.
Yeah, and that is good. It sounds like you were very aware that you were you and he was him, and you guys were
Yes.
not blending. And
No.
often in our profession, we are working, I mean, we're working in people's personal space.
Oh
There's
yeah.
a lot of dental trauma that happens. And if we're sensitive people, like compassionate people, like mo the majority who got into this field are, you can end on up carrying that. So can I do one test, one little thing, share that's going to show if you really tend to be the person who carries other people's emotions with you?
Yes.
Okay.
Yeah.
Okay, listen to me for a second. This is on purpose.
Okay.
Who's gonna fight it?
I know. I'm like, I don't even
Yeah.
have the urge to yawn.
Yeah,
Normally I do.
I do. Yeah,
So, and that's a sign of
yeah.
being an empathetic person. And so, truly, need to protect your boundaries if you had that urge to yawn or like you notice normally you would, but now you're not because you're in a different situation here. And so, for those of who are listening, if you were tempted to yawn, please start taking care of yourself emotionally as well. And make sure you leave that stuff back in the operatory.
And some of the emotions can be good. Like we share fantastic,
Hmm.
but when we do carry that, and it's not just our patients, it can be our coworkers. Like you said, the one that's talking in the background in some of that. I've left some jobs because I just felt emotionally exhausted trying to fit in. Or so it's not just our patients. I'm very invested in the individuals. I even with bristle calls when someone's telling me about their halitosis, I know it's hard not to like be empathetic with them. I remember a cancer patient. He was terminal brain cancer, and one of the appointments, it was going to be one of my last appointments with him. We both knew he was
Hmm.
not going to make it. And he talked about a concert, Bruce Springsteen. This was years and years ago.
Yeah.
and how he had loved it. And there was like one coming up and he really wanted to go and he didn't think he would be able to. I got off that night and I called his family and said, "You have to take him to this concert. I know he's not super well, he's dying." And all he talked about was that this, like his past experience at this concert, he really
Mm.
enjoyed. He ended up going with his family. They got front row tickets and brought up on stage
Oh,
with, and he
that's
had
gross.
like end of life memory with his family. And because I am that empath. But then we have those patients that I'm trying to do the blood pressure and I've got the cuff on. Is, don't you know how to take a real blood pressure? I'm like, yeah, I know, but this is what we have in our office. And then just
Yeah.
like belittling me. And at the end, I was like, I don't have to see you today if you don't want me to see you. If you don't think I'm professional enough to treat you today, I'd be more than happy to schedule you somebody else.
Yep.
I don't
Please.
deserve to be treated the way you're treating me. And if that's
Mm.
how you want to treat me, my doctor will be fine with me letting you go today.
Wow.
Yep.
Kudos. Because honestly, a lot of our listeners here today don't have that kind of support from
Mhm.
their practices,
Yeah.
whether it be the office manager or the dentist themselves.
Yeah.
Um,
And it's so important that we do that because I've had other
Absolutely.
patients who come in and they're mad because I let them go because their blood pressure was high and I say they have to go to the emergency room. And the next time I see them, I'm like, you saved my life. I did go, even though I was mad that you wouldn't do my dental procedure, but I had triple bypass surgery 2 weeks after you found my blood pressure to be high. And
Yeah.
if I hadn't done that, I could have had a massive heart attack and you saved my life. So it comes and goes, and we have to figure out how to take the good and really walk away from the bad.
Yeah. Yeah.
Yes.
Totally.
Yes.
Yeah.
And you
Right.
said something so correct on that, Heather, and that's so many professionals don't have the support of their practice to
Yeah.
handle that with a patient, and why you would want that type of attitude in your practice. It just doesn't make sense coming from a patient. Why would you ever let a toxic, there's people have bad days, but there's
Yeah.
patterns that should not be tolerated within a practice. Nobody
Right.
should treat anybody that way.
Yeah.
And Amanda, thank you for bringing that up too, and Heather too, because that starts with us. And that starts with us demanding in a nice way how to be treated. And so you might, the first time, I'm just thinking of our listeners here, you might, the first time that happens, talk to your boss or whoever you would talk to afterwards and say, that is not acceptable to me. And I'm going to tell you that next time that happens, I will just be saying, I will be dismissing them. And that's the time to have that discussion. Even before that happens would be awesome, but a lot of times it takes a push, but don't keep doing it.
Yeah.
You really need to stand up for yourself. And that's how you're going to learn to trust yourself. That's how your body's going to be able to say, oh, I can count on her to watch out for me. And
Mhm.
that's when your body and you can get on board together.
Yeah.
Yeah, that was great.
And the physical part, we have so many different things. Like you said, you're sciatic. I had one part, I like in my career that my thumb, I thought for sure I was getting like carpal tunnel. And I used to I would shake my patient's hand when I'd go out and I'd be like, oh, my thumb. And I couldn't figure out what was going on. What happened? And this is like one of the small things. Like I have little hands and I've always worn small gloves. And every glove is different. But I realized the glove was pulling right on the back
Mhm.
side of my hand. And over time, it was putting strain on my muscles as I was instrumenting my patients. And it really just took me like paying attention to the small details, like why is my hand bothering me so much? It wasn't my technique. It was my glove was
Yeah.
just a touch too tight. If it's not, if you don't have enough space and your glove is pulling in any spot, that's putting strain on your hand and you need to upsize your glove. Now that's a challenge for me because a medium, I feel like I've got the
Mhm.
dangly, but I'll take the dangly over having strain on the back side of my hand that was causing muscle issue. And once I fixed that,
Mhm.
uh,
I know. And also, yeah, and sometimes it's just the brand of the glove.
yeah,
Maybe they ordered a different brand and
yep.
you're like, oh, here we go, small, here we go.
And it's really, yeah, it's that in tune of
You had to pay
what can
attention.
I fix here to try to
That was really
yeah,
perceptive.
yeah.
Yeah. And that's what it takes. That's what it takes. So just to shift gears just slightly, if I could give something for people to do when they're feeling a little overwhelmed and how to be able to be more present so that you can protect yourself and listen to yourself. And it is the breath. And it's very simple. Just notice how you're breathing right now. Shallow breathing is holding pain at bay. Think of
Mhm.
child labor. If whoever's given birth, it's you pants, right? And it's those quick, short breaths, and that is just holding the pain at bay. If you hold your breath, think of when you're working and you're struggling with something like this, right? And you hold your breath, that is like being in shock. So pay attention to that. But belly breathing tells your body everything is safe. So even if it's not exactly safe, if you put your hand right underneath your rib cage and just breathe and make your hand move, not your shoulders or anything, and do that about 3 or 4 times, it's going to settle your nervous system. And then you can look at whatever's happening from a calmer place instead of a reactive place. Instead of one of being attacked, you can be the solid one communicating instead of reacting. So I like that one for a daily practice. That in the stretching. Stretch anything that is not, if you're always leaning over with your
Yeah.
shoulders, just pull them back.
Yep. Let's all take a moment
Yeah.
to do our
Roll the
shoulders.
shoulders.
Yes.
Take a deep breath. I do when I speak, you do an intro and I'll have people do some box breathing while I read a story to help stimulate the vagus nerve, get us focused, get us right. Because we
Yes.
don't breathe. It's crazy. Oh gosh, I forget the guy's name that wrote Breath. Finished it
James
in
Nestor.
January. What was it?
James
Nestor?
Nestor.
Yep.
Yeah.
Super good. I heard it was going to be good. I've heard many IAOMT presenters talk about just game changing. So it was on my list. And um, last year, my husband had a big health issue, and one of the core problems of his premature ventricular contractions compounded by a hiatal hernia, weakened diaphragm from bad breathing. Yep.
Wow.
Yep, which it all made perfect sense. So he did virtual appointments with a chiropractor to do breathing exercises. Yeah. So, yes,
And
breath,
it worked
it did. He also lost 140 pounds. So that was significant.
Yeah.
because of the breathing or a separate?
Diet change, breathing exercises, just becoming more aware. Like he's fully in on the functional space now. He gets it. He's there. So no more resistance from him on why I spend so much money on groceries and supplements and alternative treatment modalities.
So you don't have to later.
Exactly. It's like we can either pay for this money now or spend it in healthcare and have a crappy quality of life when we're old. I don't
And if
want
we
that.
want to learn and live in our profession as long as we want to, we need to find a modality. I think that's why there are so many choices of modalities out there because
Yeah.
there's so many different people who like things. Everybody says a massage. I didn't like massage. I found one who said, "Oh, your body wants to stretch." And
Mm.
she's fabulous. But That's not my first thing for relaxing.
Yeah, and the combination of chiropractor and massage is pretty great for a lot of dental
Mm,
hygienists. As
absolutely.
I have two of them in the family, and I don't get enough massages. Jasmine and David. And yeah, with having past injuries from birth and sitting, being petite, and then having the wrong saddle stool and not having ergonomic loops just plays a huge role on the muscular system. And doing yoga, I know there's some individuals who are huge into teaching yoga. The aligned hygienist is
Caitlin.
Yeah.
Caitlin is amazing at helping with some of that stress component and making
Yeah.
sure that,
And the
and
breathing too.
I could use
Breathing.
stretching. I learned with Jasmine and my daughter and her fiance, soon to be husband, I really enjoy them stretching me because I don't stretch enough and I don't know what I'm doing with stretching. There's stretching studios where you can go and be
Oh, I saw.
professionally stretched, which I'm like, maybe that's what I need to do because I do hold
Yeah.
everything in my hips.
And then when you can get that hip energy flowing, then it opens up energy for
Yep,
other things that you want to do.
yep.
Yeah. I've had to implement some Tai Chi moves in the mornings because I've noticed my hips are tight. And when I stand up from a long SRP procedure, I'm like, how old am I? What is happening? But when I do just start my morning, like I look so dumb. Like I'm just doing like hip circles in the morning in the kitchen. Okay, rotate. Like
Good
I'm
for
trying to do
you.
like Shakira moves in the kitchen. But it makes such a big difference in how I stand up no problem throughout the rest of the day. And it's okay if I just have to do some hip circles in the morning, Shakira, I'm fine.
Have you ever tried a weighted hula hoop?
I can't do a regular hula hoop. Are you kidding me? Can't do
Well,
weighted.
Can't do that.
they have two different types of weighted hula hoops now. There's one that's like a weighted, and honestly, I can't do that one. I feel like it bruises my hips. I did that for quite a while, but I can hula hoop like a boss. But the weighted ones
That
are,
was a very subtle flex, Heather. I
yeah.
can hula hoop like a boss.
But
Okay.
it's super helpful for all of those joints. Now they have one that you have this clipped thing that's flexible and there's like a ball thing on it and there's a string and you have to just get the ball to wing around you and then as you lose weight you can take the clip off but it's still the same exact movement of hula hooping and then you can actually do it the opposite way but that's really great exercise for your hips and your back and honestly your legs and all of that. Yeah,
All
totally.
those core muscles.
On this, yeah.
Mm-hmm.
So
Never thought of that, but
belly,
that's,
yeah,
Yeah.
you have to
yep,
keep it in your operatory.
yeah. We'd be knocking everything all over the place.
I
But
have enough space. My
yeah,
room is massive.
just a few minutes, like 30 minutes with that can be pretty lovely.
Yeah, I'm with Amanda. I'm not so great at hula hooping, but I liked that brag. That was really
I
good.
know. She's
We
just
should
so
brag more
subtle.
often.
I am so good at hula hooping.
Not trick hula hooping, but I can get it to go wrong for quite some
I
time.
feel like just regular hula hooping is a challenge. I don't know many people that say that they are a boss at hula hooping.
No. So what do you think is why do you guys think that we're having so much trouble in our profession? Just to bring it back to
Yeah.
why do you think it's people are burning out so quickly now? I know things have changed a lot. If one more thing from me is in my experience, shoot, when I graduated, our program was just as long as the program is now. We spent like 3 weeks on learning how to sharpen our instruments. And now I think you guys watch a video and so it's really changed a lot. You've packed so much more in the stuff I've gotten yearly through my continuing education. And now you're expected to, we scanned, so many things get packed into that hour. So what do you think is what makes the difference between the hygienists that can stay in and those who We just can't.
Feeling fulfilled in what you're doing, I think, is the most important thing that you need to have in a position. Are
Mhm.
you feeling fulfilled? I think in dentistry today, with and Amanda, amazingly, she does two columns. I've never done that. I've done it for a very short period of time, and that's just not for me. But the I think just the constant adding of more things without an add of time and then a subtraction of time has caused a ton of burnout for
Mhm.
individuals because we
Mhm.
feel like we're a factory more than we're caregivers that we want to be. I think that causes a lot of burnout. And because of those, if you are running behind, and we do have that patient that's, they didn't mention anything to me, but as soon as the doctor gets in there and you're already late for your exam, and the
Mhm.
doctor's, oh, by the way, I need a PA because the tooth that was bothering them didn't bother them the entire 45 minutes that you were in their mouth, but then they mention it to the doctor, and you're like, "Ah."
And then, yeah, you're the one that's the problem there. You didn't pay attention
I think there's a combination of that is more because it has changed a lot.
a
I
lot.
think insurance
Mm.
reimbursements are making it really challenging for offices to thrive in the space. So they're the dentists. I get it on the business side as someone who's been hygiene director. You have to make money, right?
Mhm. Yeah.
But there has to be a balance of the care that we're providing and feeling fulfilled in what you're doing
Hmm.
to make it through. And you have to like what you're doing. And really, like you said, on making sure that you have to come in the day, say, I'm going to rock it. This is going to be an awesome day. It's all about positive affirmations and how I love what I do right now. I've always loved hygiene. And I think that you have to have the attitude of, I just love what I'm doing. Because if you have the attitude of, oh, I just can't do this anymore. And there's so many hygienists online that I see that it's just such a negative component. I don't think I can manage this anymore. You have to change your perspective
Yeah.
and how you view what you're doing to find the fulfillment and manifest that with what you're doing. Because when you truly believe you're making a difference, even if it's in one or two patients a day that you've made a difference and that's what matters to you, you need to focus on that.
Yeah.
I think that's really important. But I think fulfillment is one of the biggest things that makes a difference. And you have to say things out loud. Like keeping it inside. I've been doing this for my speaking. Like years ago in my head, I was like, I really want to teach. I want to build people. My goal is to make hygienists better. And finally, I just started telling people, I'm going to speak someday. I am going to speak. It holds me accountable. If
Mhm.
you're keeping your thoughts in your mind and you're not saying it to other people, you're not manifesting well. Because
Right.
when you are telling people what your goals are, you have to hold yourself accountable for what your goals are. So
Yeah.
I started 4 years ago. Someday I'm going to speak.
And look
And
at you.
now, what am I doing?
Yeah.
But
Yeah.
I wasn't able to do that until I manifested it and started telling people this is what I wanted to do. Surround yourself with individuals that support you in your goals. I think that's another really important thing is if you're in an environment that's manifesting negativity,
Or a
and
very
there's a
limited
shortage of
growth.
hygienists.
Yeah.
Yeah.
We are not stuck in one position anymore.
Yeah.
When I first started hygiene, I think I would apply to 4 or 5 or 6 different places, and sometimes I would never get a call. There was an overabundance of
Hmm.
hygienists.
Yeah.
Now I don't know how many times a week I'm like, hey, we're looking for a hygienist. We're looking for a hygienist. There's a shortage of hygienists.
No. Yeah.
We are not stuck in any position at this point. We have the choice to find the office that's going to help you manifest what fulfills you.
Yes. And to be fulfilled, you have to feel, in my opinion, you have to feel like you're making a difference.
Yeah.
And one of the things that I think we often find ourselves being shoved into is doing bloody prophies
Yes.
just to get it done. You don't have the time to sit down and talk to the patient. You don't have the time. And like we were saying, shift your perspective. What if your best time can be used telling that person, I'm really concerned. This is what I'm seeing, and this is what this means to me. Like you said, you guys listen to your patients. Maybe you didn't get anything done in dental wise, but you made a difference in their lives, and not only their life, but their family's life. And so when we are with that patient and thinking, how can I serve them best? That day's production may be down. However, they are going to get the care and the treatment that they need, that they deserve, because we are reminded again and again that the mouth is a gateway to the body. And if we don't get that healthy, you're not going to be healthy in your body. There's always going to be something that ties back there.
Yeah.
So we owe it to our patients. We owe it to our practices, and we owe it to ourselves most of all to be able to practice to the level that we learned and to hold ourselves to that. And if that's not able to be done, discussions need to happen.
Yes. And my true belief is if someone is highly focused, we should not be doing bloody prophies. If we're looking for production, if the dentist is looking to increase production, we should be allowed to diagnose and treat
Yes.
and educate, because the more we can educate the patient and get them to understand the disease pathway, it's profitable. It is
Yeah.
not profitable just to turn prophies.
No.
And I don't come at all from a production standpoint. I'm a full believer. I probably would overtreat at this point in adding adjunctives after being in the oral microbiome space. I think if we were testing people, we would be not doing
Oh,
bloody prophies all the time. We would be doing prophies and adjunctive therapies to get
yeah.
them improved way before the bloody prophy can even
Even
happen.
happened. Absolutely.
So I think we don't use adjunctives enough in treatment. And if we tested more often, we would see disease pathways and where we could refer and utilize other practitioners to help gain health in our patients. And hygienists are healthcare providers. We're not prophy wheels.
Yeah.
So when we diagnose, and our diagnosis should always be probing, reading, doing the base information. Your exam is what's taking you. Just because they're scheduled for a prophy doesn't mean you're locked in to
Right.
doing that. Oh, in my findings, this is what I'm finding today. I don't have enough time to provide that service today because I want to do a good job for you and make you healthy. And me spending the next 15 minutes scraping your teeth is not going to provide health. So I would rather have you come back. So now that we've diagnosed this, I can treat you better, add some adjunctive therapies that are going to improve your health and your oral health. So I think that we get stuck in this prophy and I got to get this cleaning done no matter what. And you don't.
And you don't.
Halt. Take your
Absolutely.
assessments and say, you know what, this is what my findings are today. And I can do better for you if I schedule you back and provide the services you actually need for the disease that I'm seeing.
Yeah, and then it's a win for the patient, a win for the practice because you are actually improving your production or increasing your production, and it's a win for you.
Yeah.
I
And
mean,
it's
I
a
love
win for
a
the
good
patient
triple
because
win.
you're not just churning and not truly
Right,
dealing.
the patient's number one.
Yeah. And Sally, how many people do we coach who have no idea what the health of their mouth is? You have to ask them many questions before you're like, okay, you have periodontal disease, because they were not explained properly the disease process to understand that the deep cleaning that they had 3 years ago and now are still on prophies was treatment for gum
Mm.
disease. And they have a disease process, which is probably why their perio score is out of control on the bristle testing. So we're not treating because then they fall off and they head back into a prophy and they're just not treated properly.
Yeah.
So, yeah,
Um,
a few things. I know that your listeners have heard a lot of things that have maybe shifted their mind into looking at their dental career differently. And hopefully we'll get some more good hygienists staying around a little bit longer and not leaving
that
because they're miserable.
Yes, that is it. I think Heather very comprehensively answered your question. Just that fulfillment. And school is a great starting point for your education. But hygiene school is just there to get you to pass boards.
Mhm.
Let's be real, it's not. And
It's the
each
base.
type, yeah, it's a baseline to get you to work in just about any practice. And when I graduated almost 20 years ago, I did not feel ready. I know, child's play for
I
Sally over
know.
here. But just how so much has changed for you. I mean, I had a patient yesterday who he is an 80-year-old gentleman and he was a x-ray tech in the military. And so I was using my Nomad and my sensor and he's like, "How long have you had this technology out?" And I was like, "Ever since I graduated." In school, we were still learning on the traditional films. You had to develop and fix and we were reminiscing about that. And he was just like, "Oh, that's so crazy." I'm like, "Now they have Bluetooth ones, so there's no cord attached to this, which is incredible." Because I hate, there's just so many
Hmm.
cords in dentistry.
Yeah.
I'm like,
Talk about, yeah,
I'm not.
occupational
So,
hazards.
yes, so many. So, anyway, he was just enjoying it, just the chat and the reminisce of he knew what I was doing to a degree, but
Yeah.
just how much things have changed. I feel just in the last 10 years, things have rapidly changed with
Yeah.
CBCTs and how we've changed the P standards for how we assess periodontal disease. That
Mhm.
has drastically changed, but I did not feel prepared as a new grad to practice on my own at all.
Oh,
Point in case, I moved to Utah 6 years ago. I've been working for a DSO. I've never worked in a DSO corporate space before in my life. Now, previously I was at small practices and I probably had a 2 year burnout of that practice where I was like, okay, move it on. Don't like this. I'm not learning. I'm not growing. Didn't have that mindset either and I happenstanced into a practice. I remember applying to this office thinking, oh, I'll only be here part time. And I still sometimes go back and work at this office. Like they fly me back to New Mexico occasionally to work just because I was the right hygienist for the job. But I had never worked in a practice that actually invested in me so much. The expectation was incredibly high, but how they went about preparing me for that expectation was nothing I had ever experienced before. So that level of support
awesome.
was just unparalleled. And so I felt very supported. I had a huge learning curve because it was a cosmetic office. Fast forward now, working in a DSO where a doctor is not my boss, I get to
Mhm.
set my standard. I get to set all of the protocols that I want. I have so much more fun at work and I am so much more vested. Now, had I stepped into that as a new grad, I would have been a mess. I can
Mhm.
guarantee you the patients would have been a mess because I was not there. And that is just my unique story where I was at as a clinician. I wasn't ready for it. So I
Mhm.
think everybody has to walk their own path. And I am 100% enjoying where I'm at, what I'm doing. Even double hygiene, I wasn't sure how I was going to like that. I'm less tired at the end of the day because I'm not doing the things I don't like. I'm not
Mhm.
taking x-rays most of the time. I'm
Mhm.
not polishing. I am going in, I am showing them education, I'm spending time. I have an assistant that's dedicated to me to perio chart with me. She knows what I do. She takes the blood pressure for me, and I just get to walk in and be the hero. And so that's and I support that with the patients. They know that, they see that, and I'm like, oh yeah, Sally or whoever is my assistant, she's done all the hard work. I get to come in and do the fun stuff. So how are you doing today? How can I help you with your oral health? And it just gets to set the stage to be so much more fun.
Mhm.
But
Mhm.
Amanda, as a new grad, she would have been a mess in that type of a situation.
Yeah, yeah.
Yeah.
And that's so cool how you evolved as you went through. Do you know,
Yes.
that's a cool thing to notice and really celebrate yourself for that.
Yeah.
And thank goodness it showed up when it did because that's keeping you excited in what you're doing. And
Very
probably,
much.
yeah, wouldn't have. When I first graduated, 45 minutes was a long time to have. And I started working for a dentist similar, but it was a 30 minute. It took me a while to get my speed going after graduating. And this guy didn't care a lick about what I did as long as the teeth were shiny when I was done. And so I learned so much, a half hour prophies, and I just went in and I practiced my skills. And now I look back and I go, oh my God, those poor people.
Yeah.
And it was what I needed because it got me working faster, thinking faster, getting out of the school mentality and really experimenting with what worked for me because he didn't care. So I had autonomy
Right.
in a half an hour. But it is funny how those things show up for you when you need them. That's really cool.
Yeah. Everybody's journey is so different, and definitely I didn't have a lot of dental background going into it, so I didn't have that. I was like, tooth numbers, what? Surfaces, do I really have to know this? Yeah, questioning everything in dental hygiene school. Do
How
I really
important can
need to
that
know
be?
this?
It's funny because every once in a while I'll see someone post like, how much chemistry do you really need to know? Or how much? And if anyone saw or followed my podcast with Nathan Bryan, you need the chemistry,
Oh my
guys.
gosh.
That was such a heavy chemistry conversation. I was like, I'm sitting
He
back
was
and I'm
so
like, this is
great.
why we do chemistry. Exactly why we do chemistry.
That was a
We're,
fabulous,
yeah,
fabulous
physiology and
interview.
chemistry, it's all important. What we have to understand what we're putting in, what the impacts are, what the bodily functions are, physiology. It's all incredibly important to understand and put together. And I remember pharmacology, I was like, ugh. I
Ugh,
mean, that,
the
Yeah,
but
worst.
and once again, that
it's
podcast kind of
important.
talks in. I talk a ton about. I don't know. I still look up medications when I'm doing coaching calls and I'm talking to, and it's crazy. Sometimes I look up the medications and I say to the hygienist that I'm consulting with for Bristol, I'm like, some of these medications have contraindications to them when you're looking them up out of our space, but I don't know. You might want to mention that there's some stuff in here that maybe the doctor should look at your list of medications because sometimes
Multiple
sometimes they're seeing
doctors.
multiple
Yes,
doctors and the
right.
pharmacist should catch that. But there's sometimes where I look up and I'm like, contraindicated. Three medications are contraindicated. I'm like, you might want to have the conversation. She's, but that's outside my realm. It's outside your realm of prescribing, but it's in your realm to say these medications, there's some flagging when I look them up, and we were taught to look them up in hygiene school extensively for those contraindications. It's okay to bring it up and say, you might want to just talk to your physician about these three medications and the combination if they're safe together.
Yeah.
That's what you have to do.
Yeah.
And that's why, Amanda, what you just finished your functional
Mhm.
health
Yes.
degree. And so that is why we all three of us are looking, and many hygienists who are listening to this are looking at the whole body
Yeah.
because it does matter. And we're the ones who get to spend the most time. We hear this all the time, the most time with our patients over any other healthcare provider.
Yep.
We get to
Yes.
spend the most time with those patients talking with them. And so we are the first line of defense.
Yep.
And so,
100%.
yeah, we need to really be strong.
So,
And to
yeah.
be that good defense, we have to take care of ourselves.
Yes.
Yes.
Yeah.
No.
Awesome.
Oh,
Sally, I know you have a ton of different information. Can you tell us a little bit about what you're doing? Tell us about your website, what you're offering to hygienists, because we're talking about all of this information, but you work independently with hygienists on some of these modalities, how to deal with burnout and that sort of thing. Tell us about your website. Tell us about what you're doing, some courses. We are going to include a course that you shared with us to the listeners to go ahead and view and look at. But tell us a little bit how you work with hygienists to help through some of these pathways.
Thank you. Yeah. So my website is yourblissfuljourney.com. And on that site, I've got some resources that are helpful. And what I do is I actually help hygienists who are, gosh, we're strong and capable. And we're amazing at what we do, and we're super good actresses and actors. And we pay attention to everybody else but ourselves. And that the to our detriment. And so what I help hygienists do is bring that attention back to themselves and learn to actually understand the language of their body so they can hear what their body is saying, know what is true for them, so they can act confidently. It bridges between home and work, leaving stuff at work, leaving stuff at home, so you can be right here, right now, every time you are right there in the moment. And that makes a big difference because we can't make anything happen in the future and we can't make anything happen in the past. The only time is right here. So if you want to create the life you want, you got to work right where you are. And so if you appreciated any of the conversation, the story I shared, and want to go a little bit more into that kind of information, the class that Heather and Amanda have in the notes will give you 2 CEs, and it's a 2-hour class that will go a little deeper into some of these metaphysical type tools that will help you be able to live. If we don't like the word metaphysical, you could say quantum mechanics tools. So that'll help you live there. And I have another free gift that I'll make sure you guys get in the note that you can just look at that as well. So yeah, I'm working with hygienists one-on-one in groups so that we can all basically, like I had said earlier, work in the profession that we love, if we love it, as long as we want to stay in it. Don't let it kick us out. And shift how we're feeling, because then everything around us changes. And it's the truth. I learned this so that I could survive. And I'm hoping that I can help others with that.
Same. Thank you so much, Sally, for sharing this, for having a passion, for setting a goal for all of us to be able to practice as long as we want physically and not be forced to leave a profession that we worked so hard to get through school for, invested so much of our time and energy in, and just being able to be the providers that you want to be is critical. So thank you so much for sharing that and for just pouring out to hygienists and wanting to elevate our profession.
My pleasure. Thank you for having me. This has been so much fun. You guys are awesome. Always have good things to listen to, so I appreciate it.